So for question number 1, explain the main component of lumbar segmental stabilization exercise for housewife with lumbar stenosis and why is it important to have it done correctly. So there are 3 main components to lumbar segmental stabilization, which are segmental control of the primary stabilizer. Primary stabilizers are diaphragm, pelvic floor muscle, multifidus and transverse abdominis. And the second component is closed kinetic chain with low velocity and low load. And the third one is open kinetic chain with high velocity and high load. Why is it important to have it done correctly is because first it strengthens the muscles, it helps to reduce pain, it promotes good posture, and it trains the responsible muscle to work correctly. Question 1B, demonstrate the correct way of abdominal hollowing in sitting. Okay, in sitting, maintain the proper posture in sitting, and then breathe in and out as normal as usual, and try to pull your belly button inwards towards your spine. While doing that, you have to make sure that there is no abnormal movement of the rib cage, the pelvic and the spine. And you have to maintain the correct posture at all times during the abdominal hollowing. So pull your belly button, your navel inside and out. We start with just getting the right and the proper way of doing it first, and then we try to hold the contraction for 8 seconds. If patients are unable to hold it for 8 seconds at first, try with 3 seconds and with 3 to 5 repetitions, and then gradually increase to 5 seconds, and optimally we want to hold it for 8 seconds with 30 repetitions. But if the patient is unable to do it, try to do it progressively, as in do it in at first maybe 3 seconds and then 5 seconds and then gradually to 8 seconds hold with 30 repetitions. For question 1C, abdominal hollowing in standing, same. First and the very most important is to maintain a good posture. So proper posture in standing, and then inward, belly button inside, navel inwards toward your spine. Hold the position for 8 seconds and release. Breathe in and out as usual. Do not elevate your rib cage or move your pelvic or the spine. So again, pull your navel inside inwards toward the spine and try to hold the position for 8 seconds and 30 repetitions. If patient unable to do 30 repetitions straight, they can break it into few repetitions first. For example, hold it for 8 seconds and for 10 repetitions, and then rest, and then do another 10 repetition, and then rest, and another 10 repetition. So while pulling your navel inside inwards, try to maintain good proper posture, and breathe in and out as normally. One way to teach patient to do the abdominal hollowing correctly is as if we are trying to button our pants, like trying to button our jeans, and then we need to hold it in. So that's another way to look at it. That's another way to teach patients to how to perform abdominal hollowing. Belly button, navel inwards toward the spine, and then hold that position. You can also put your hand at the axis and feel the contraction. 8 seconds and let go. For question 1D, limb movements with abdominal hollowing in standing. So while maintaining or while performing your abdominal hollowing in standing, you can move. This is a progression that where you can move your limbs upwards and downwards, one limb at a time, and then sideways and down. And also you can do the reaching movement forward, reaching sideways, while maintaining your abdominal while performing your abdominal hollowing. Good posture is to be maintained at all times.